Good afternoon, everyone, and welcome. I'm Alex Rosenblatt, member of the Board of Directors of the San Francisco General Hospital Foundation. I'm honored to be part of this today for innovations in public health. First and foremost, thanks to all for being a part of this very important conversation about reducing violence in our country and reducing gun violence throughout our country. Our mission is to fund and support Zuckerberg San Francisco General Hospital because we believe in health equity, access, and quality healthcare for all, built on the pillars of innovation and new models of care. Our supporters, many of whom are joining us today, enable the life-changing work that happens day in and day out at Zuckerberg San Francisco General Hospital. In ordinary times, and especially during the most challenging times, as we've experienced for the past 17 months of the COVID-19 pandemic. Even during a global pandemic, gun violence increased, devastating communities, and reinforcing the need for leadership and policy change at the federal, state, and local levels. Gun violence is a public health crisis. Leading today's important conversation on the need to define gun violence as a critical public health issue is Kim Meredith, CEO of the San Francisco General Hospital Foundation. She's joined today by Dr. Andre Campbell, a world-renowned trauma surgeon, and Congressman Mike Thompson. Dr. Campbell is a professor of surgery and vice chair for the diversity, equity, and inclusion at Zuckerberg San Francisco General Hospital. He's one of the most decorated surgical educators around the country. Through witnessing the destruction guns can cause, he has become a vocal advocate of gun violence prevention programs, most recently speaking out against the proposed reversal of the assault weapon ban in California that has saved countless lives over the past 3 decades. Congressman Thompson is a ranking member in the US House of Representatives, representing the 5th Congressional District of the state of California. As co-chair of the Bipartisan Military Veterans Caucus, he led the effort to improve treatment options for service members suffering from post-traumatic stress and traumatic brain injury. In the wake of the school shooting in Newtown, Connecticut, Thompson was named chair of the House Gun Violence Prevention Task Force. Thompson is a hunter, gun owner, and a strong supporter of the Second Amendment, and believes that Congress and others should do more to reduce gun violence.
Thank you, Alex, and welcome Congressman Thompson and Dr. Campbell. As Alex noted, 2020 was one of the deadliest years on record for the United States. According to a recent Washington Post article, gunfire deaths began to rise in April of 2020. And when COVID-19 shut down much of the country, in-person schooling was paused and more than 20 million people lost their job. Every year, nearly 40,000 people die because of guns in the United States. As the COVID-19 pandemic intensified, the impact of our country's gun violence crisis grew. There were nearly 4,000 additional firearm deaths and close to 3,900 firearm injuries in 2020 as compared to 2019. This relentless pace has continued through the first 5 months of 2021, with gunfire killing more than 8,100 people in the United States. About 30 people a day are killed by someone using a gun. And when including suicides and accidental shootings, the number rises to nearly 100 lives lost a day. So Dr. Campbell, how did we get here? How did gun violence escalate to the point in which we are deeming it a public health crisis?
Well, good afternoon. First of all, I want to thank you from the foundation for having me, Kim, today. It's just really outstanding opportunity to talk about something that's very, very important. I mean, also want to thank Congressman Thompson for coming and his relentless advocacy in this area for many, many, many years. So the first thing I'll say is that the cycle of gun violence has been up and down over the years. So if you look at the last 30 years, in the 1990s, the numbers were really sort of escalating, getting higher and higher, up to the point when I was training in New York in the mid 90s. We had upwards of 2,000 homicides a year in New York, which was just a terrible, huge amount of lives lost. And now that number over the years had gone down because of a lot of different changes in New York City, San Francisco, Los Angeles. So New York, the number of deaths have gone down to 300 or so. So just to give you an example, what happens in big cities. So since the pandemic, so what has happened? So during the pandemic, when we were on lockdown, the numbers actually went down significantly. And then what happened was, as things began to open up, the numbers sort of began to increase. And if you look at things over the last number of years, so between 2016 and 2019, that number that you're using of 30 or 40 people a day being killed related to violence and firearm injury, has now gone up to the mid 50s. If you're looking at just homicides, if you're looking at the whole universe of things, including suicides, the number is much greater. So the way I think about it from the standpoint of a public health crisis, think about this: if 15 to 20,000 people were being killed in plane crashes around the United States. So you're talking about 30 or 40 wide-body jets crashing during the whole year, right? We would actually not be flying anywhere. With that number of people were being killed because they were flying around, that wouldn't happen. So if we begin to look at this gun violence as a public health crisis and an emergency, then we begin to think about things for, well, what can we do as a country, whether or not it's obviously behavioral changes, legal changes, policy changes, both on state, local, and national level, what we can do to make the changes to make things better over the years. So I think you have to look at it like that. I mean, every day, the things that get the most publicity is the greater than this year. So far, we've had over 300 mass shootings with countless lives lost, over 1,000 young children and adult, many more adults have been lost for that. But every day there's another mass shooting, and we kind of get numb. But the reality is there are real people who are losing their lives. So that it's not only just the people who die, which is obviously a terrible tragedy, it's the people around them, it's the family, it's the post-traumatic stress. There's a whole series of things happen. So there's 15 to 20,000 people who were killed by homicide, but there's 150, 120,000 people who are shot and injured, and maybe they're paralyzed or maimed, they have a head injury, all these things that I deal with every day at San Francisco General Hospital. You know, people who come in and their life is basically ruined because of the things that they've had. They've had a head injury, they can't provide for their family, they can't live a normal life, they can't take care of themselves. So these are really huge numbers of people who are being affected. In 2012, the number is estimated to be roughly $240 billion of cost for gun violence in the United States. And that's about 1.5% of the GDP. So that's a huge number. So if you begin to start looking at the big lens that this is a gigantic problem, and we have to look at it so that we don't have people who come to see us at San Francisco General Hospital and other big trauma centers around the country, right? So that's just a broad strokes of what's been going on for the last 20 or 30 years in the United States. So I'll leave it there. And of course, I'm happy to answer any other questions that you have. But thank you so much for letting me lead this fantastic discussion this afternoon.
Well, thank you, Dr. Campbell. I'd like to ask a follow-up question. So about 22% of individuals and about 40% of households report owning a gun, making up that 400 million gun owner or gun figure that you shared. The US has only about 4% of the world's population, but owns about 40% of the civilian-owned guns globally. So as gun purchases hit historic highs in this last year, and clearly this was exacerbated by the pandemic, but purchases shifted from this kind of hunting and sport shooting gun to handguns for self-defense. And so how does that contribute to what you see as this public health issue?
So I guess there's a couple things I would just mention is that I was involved in with the governor of California and the attorney general, the mayor of San Francisco, and against the reverse of the assault weapons ban, and the judge had compared it to a knife to an AR-15. To me, I'll just start out by saying, and I'd be interested in what Congressman Thompson says, is that an AR-15 is not a gun that you have for hunting. I've never been hunting, so I have to defer to him. But it's just something that shouldn't be used as a hunting weapon. And so for that matter, it's a weapon of mass destruction, shouldn't be used in the streets. So I'll just sort of get that out there. And of course, that ruling has now been reversed. And for right now, that ruling is still in place. There is a 30-year assault weapon ban in California with respect to handguns. So people buy handguns for protection because the idea is that the more good guys and good women, good people have guns will outnumber the bad guys with guns. And the answer is that is not true. Is that the more guns that are available is the more you're going to kill your friend, you're going to kill your family member, and you're going to kill your kids. You get startled, you pull out a weapon, you're not well trained, and all of a sudden, there's terrible tragedy. And for that matter, if the gun is not locked up, and part of the initiatives that we'll talk about later on is gun locks and putting the guns, locking them away in the safe, making sure that the pistol has locks on them. So all these things are important, because what happens is you can't get off the news. A week doesn't go by where a 3-year-old brother kills his 5-year-old brother with a gunshot to the head. Or something like that, where that family is just permanently wounded, and it results in just massive tragedy. So I think in a lot of ways it's really a myth. Now, I don't think anybody, if you're licensed and you're trained, nobody really wants to take away your guns, but we want to make sure that things are done safely, and there's just no reason for that. To me, and I'll just say this, and not to be political and not to take up too much airtime, is that what happened in Texas, where you basically don't need a license, you can just go and open carry. That to me is totally ridiculous. That's a recipe for disaster, right? Where there's guns. There was just a case in Denver, Colorado, and I'm sure the congressperson heard about it, Congressman Thompson, where basically a good guy comes and kills the bad guy, and the cops come and kill the good guy, right? Because they're there. And that's the problem when there's too many guns, right? Innocent people get hurt, and innocent people get killed. And that, from my point of view, I don't want to see that. I don't want to have to go in a quiet room and tell a family that somebody's dead, and then I'm going to ruin their life, because that is the absolute worst thing that I have to do every day as a trauma surgeon at San Francisco General Hospital. With that, I hope I answered your question. And
thank you. Thank you, Doctor. Thank you, Dr. Campbell. Yes, you've given us so many examples of how this public health crisis continues. Not only does it continue, it continues to grow. And just even reflecting, I was saddened to learn that last week on July 4th, there were over 400 shootings that day with 150 deaths, as an example, just literally one day. So turning to you, Congressman Thompson, as the chair of the House Gun Violence Prevention Task Force, you see the impact that legislation can have on combating and decreasing gun violence. And Dr. Campbell just mentioned a few examples, but our numbers continue to increase. So what is being done at the congressional level to address this escalating public health crisis? And welcome, thank you.
Well, thank you. And thank you very much for asking me to join you. What a great opportunity it is to be with Dr. Campbell. Thank you for all that you do. And thanks to all of you at the hospital and the Hospital Foundation for the great work that you do and the service you provide the community. Let me say first, thank you for pointing out the fact that every day this is a problem. So often people only see or hear or read about the spectacular events, the terrible, horrific mass shootings that claim many, many lives. But as you point out, every day, 30 people are killed by someone using a gun. And if you add suicides and accidents, it's 100 people every day. And Dr. Campbell, thanks for pointing out the cost of this. Sometimes that gets papered over, but and the new numbers are up about $40 billion. It's about $280 billion annually that it costs, that gun violence costs. This is the cost to government. This is the cost to healthcare. This is the cost of survivors, people recuperating. It is a tremendous problem. And it's one that we all need to get together and work on if we're going to see this thing resolved. As you pointed out, I chair the Gun Violence Prevention Task Force. I was appointed to that by then leader Pelosi, now Speaker Pelosi, right after the horrific murder at Sandy Hook Elementary School. And we worked with every group imaginable, from people who thought there should be no guns in private people's hands to people who believe that there should be no restrictions on gun ownership, to try and figure out the best solution forward to prevent gun violence, or they're never going to prevent it, to help prevent gun violence, to reduce the numbers, to protect the Second Amendment as it should be, and to bring about some common sense reform that will keep our communities safe. And all of the experts agree that the best way to do that is to expand background checks, to make sure that before someone buys a firearm, their background is checked to ensure that they're not a danger to themselves or to anyone else. And the doctor said it, we don't want to take anybody's guns away, but everybody agrees that there's some people that just should not be able to get their hands on a firearm. And if you're a danger to yourself or others, you are one of those people. And the only way that you can figure out who they are is if you do background checks. Now, California has a pretty vigorous background check requirement, but there are a number of states that only follow the federal law. And the federal law says that if you buy a gun from a federally licensed gun dealer, you have to have a background check. So you've got a situation where someone can walk into a federally licensed firearm dealer, be turned down because they're a domestic abuser, they're a felon, they're dangerously mentally ill, whatever the case may be. They can walk out the door, go to the computer store next door, go online and find a private individual selling firearms and buy the exact same gun without having a background check. And that's wrong. And the American people understand it. That's why over 90% of the American people support my bill that would expand background checks to all gun purchasers or potential gun purchasers. So we need to make sure we get that passed. It passed out of the House. I have bipartisan co-authors. It had a bipartisan vote, and it's over in the Senate. The difference now is I passed it in the last Congress too, but it joined a pile of bills on Mitch McConnell's desk that were doomed from the start. The difference now is Chuck Schumer is running the Senate, and he's told us that he'll give us a vote on that bill. The hurdle is to get 60 senators to allow that bill to move forward. And it's hard. It's the only place in the world where background checks are a partisan issue today is on the floor of the US Senate. And it's going to be hard to get those 60. But my Senate author, Chris Murphy, he's working it hard. He's working with some Republican senators who tell him that they would like to see something done. And hopefully we'll be able to get it, we'll get it out of the Senate. And I know that President Biden will sign it. So we just need to keep working on it. And a lot of this is going to be what the American people do. They're going to have to demand that their US Senator take this measure up and help make their communities safer. There are a number of other things that we can do. The President Biden has been very outspoken on his efforts to deal with this issue. Everything from better regulating bump stocks or ghost guns. Those are guns that you can buy in a kit form. They come without you having to go through a background check. They don't have serial numbers on them, so they can't be tracked in case of crimes. And I'm told you can put one together in about 15 minutes, and they will kill someone just as effectively as a gun with a serial number that you buy already assembled. We have this problem with these concealable assault weapons. They come without a stock on them, so you can easily put them in your clothing, and they have a stabilizer bar. The president's been very outspoken on those. And we also need to go after the gun traffickers, the people that are making money buying guns and selling them to people who shouldn't be able to have guns. And then we've had great success with the red flag laws. We just need to make sure that we do more red flag laws, both at the federal and the state level. So we've got a lot of work to do. The environment is much better today in which to do that work than it was in the last Congress. So I'm hopeful we'll be able to get some things done.
Thank you. Thank you, Congressman Thompson. I think you're right. There's definitely two probably important shifts here. One, you have an administration that is ready to work with you. And at the same time, there seems to be this growing awareness within the public. As you said, 90% of Americans support some sort of gun background checks. And I think there's sort of this third element that brings both of those together, that during the COVID-19 pandemic, everybody could see these increases happening, and it really kind of intensified the impact on our communities. So, Dr. Campbell, shifting back to you, when you think about kind of the two pandemics around COVID-19 plus gun violence, and then you add in this at least positive and supportive administration, we did see that that with the two pandemics, that there was sort of this disproportionate impact on Black and Brown communities, but we also have this greater awareness by the public and certainly by the current administration. So how would you comment on that in terms of sort of the effect disproportionately on Black and Brown communities as we think about all these issues that have surfaced?
Well, the first thing is that, so when the pandemic first struck back in, February 2020, or it actually sort of probably came in December, January of that time, there wasn't a lot of data on what was happening other than people were dying. And what happened was, slowly but surely, as we started to get information about what happened, is that we began to see the disproportionate effect on African Americans, Latinos, and Native Americans. In fact, that people were actually being admitted to the hospital who were underrepresented minorities, and 2 to 3 times the number of the majority population. In fact, getting an ICU, and in fact, dying in much larger numbers than in the population. That was true for New York. New York was the original epicenter, and then it's kind of now spread out. And then we had our second wave, which really affected us out here in California, as you know, between that's December and January. And what we're hoping is that there's not another wave that with the rise in vaccinations as we do. But the big thing there was that it was disproportionately affected Black and Brown communities in terms of hospitalization, ICU, and death. And the huge numbers of people died. In California, we're north of 60,000 folks dying. In New York, it's north of 50,000. But that doesn't mention the millions of people, over 3.4 million people who've had the infection over time. So we always knew that there's disparities in healthcare and outcomes. This disparity is true in cancer outcomes. African Americans and Latinos and Native Americans present later with cancer diagnosis, whether it's lung cancer, colon cancer, prostate cancer, breast cancer, and the outcomes are worse. And what we found is also with trauma, that there is disparities in terms of outcomes, and that may be because of comorbidities or pre-existing conditions that people have before they come in. Because once they come in, we of course do everything we can to treat everybody the same way. when they come in, but in incidents in adults and kids, there's different disparities. So likewise, when it came to gun violence and homicides, is that the numbers of African Americans who are affected by homicides are disproportionate to the percentage in the population, and that number is varied over the years. African Americans represent roughly 13% of the population, but there are a greater percentage of homicides that happen. So this is another terrible fact that we have to come to terms with, is that African Americans are being affected disproportionately by the pandemic and the healthcare, the crisis, the public health crisis of gun violence. So those are real things that are tangible that are going on that we're going to have to come to grips with as a country. And that's why there's been much more outreach with respect to the African American community now, and getting things out I'm talking about the vaccines, getting it out to the drugstores and people's neighborhoods, going to schools, barbershops, and churches, just to sort of make sure people know that these things are safe and they're not being experimented on, because there's a lot of distrust across the board. But it's interesting that there's two types of populations when it comes to the vaccine. There's vaccines that you can educate folks, right? They understand and they take it, and that's actually more common in the African American Latino community. Once you talk to people and you express their fears about it, then they do it. Whereas there are other groups of folks who are more in the South who have not been as eager to take it. In fact, are very resistant to that. So I think a lot of it is about education and making sure that people know exactly, what the cost of that problem is. But certainly the pandemic has echoed the gun violence pandemic or epidemic that we've had for many years in the United States.
Thank you. It was also, I would note that with so many children at home doing schooling at home, parents working at home, that there was sort of this social isolation combined with economic struggle that certainly led to some increased gun violence. And in particular, I worry about these children who were homebound like never before. And so, I don't know, Dr. Campbell, if you'd like to comment on that. And then also maybe you, Congressman Thompson. I mean, that when we think of the children, it makes it even more devastating to all of us as we think about that.
So it's sort of if you think about things like this, is that if there's strife in the home, if there's discord and you're home with someone that there's discord with, this is going to go up. So actually domestic violence has actually gone up as a result of the pandemic, and that has played out in more family-related incidents of assaults and shootings and things of that nature. So if you're at home and you've lost your job and you're struggling, and there's pressure on the household, which there invariably will be, and that will make it even worse environment for the children who are present in the household and the women, the men who are, depending on what the situation is there. So that has actually amplified some of the concerns that we've had, and things that we've seen, is that there's certainly more domestic violence. There's more depression. I mean, I think you probably saw a couple of days ago, the incidence of overdoses has gone up significantly in the general population, around the pandemic. So this is because this is something we're not used to. This is a once in 100-year event, right? And remember, the pandemic of 1918 went to 1920. So here we are about a year and a half in. We have 3.4 million cases, 604,000 deaths, and we're now trying to see our way out of this. And we're again still having roadblocks with that. But certainly domestic violence has gone up with the pandemic.
I agree with everything that Dr. Campbell said. And I just want to point out one other issue as it relates to kids. I can't tell you how many young people in the district that I represent have come up to me and said, I'm worried that our school is going to be next. So just the threat and the concern that kids harbor regarding gun violence is a huge problem. It disrupts the way they study. It disrupts the way they act. It causes its own series of problems outside of the actual gun violence problem. This is not a good environment in which to raise, educate, or educate kids. It's going to affect how they grow up. And Dr. Campbell, you talked about the actual gun violence and the work that you do at the hospital in regard to that work. I think it's also important. I'd like to hear what you have to say about this. With an increase in gun violence, that means other patients are impacted. Patients coming in for other medical problems, everything from routine medical treatment to trauma treatment. The number of the 30 people to 100 people every day number, and that doesn't even factor in the people that are wounded who come in and get patched up in your shop. And that's got to distract from the regular business that you do and impact healthcare. We know it impacts healthcare costs, but delivery of service to other patients.
It has had an impact. So what has happened, at least in our place at San Francisco General, is that we reduce the amount of elective surgery so that we can deal with related to the pandemic, but still the incidence of violent crime increased, and we're quite busy doing all kinds of other things, so that it does make, in order to provide care for those folks. And I have to say that 10 years ago when I was on call, I used to have sometimes 5 and 10 gunshot wound victims a night. And, of course, the things that make the big headlines, and whether or not it's a mass shooting in Colorado or in Texas or the Columbine or Sandy Hook, that really tragic event, those make the big headlines. But or even here when we had the YouTube shooting, those things make big headlines. But the week before the YouTube shooting here that we had a couple of years ago, there were 8 people shot in a barbershop shootout in San Francisco, and I didn't see anybody here sort of even focusing on those kind of things. So that these things, so I have to say that now I'm beginning to see more of what I saw 10 years ago. I mean, there's just more, violence level have gone up more, and it's creeping up. Certainly in New York, Los Angeles, San Francisco, the numbers are going up here. I don't know the current numbers of homicide that we've had, but the busiest year we ever had was about 150 or so homicide victims in the mid 90s, and the number's sort of been about 40 or 50 over the last few years. And I'm not sure exactly where it's at right now, but certainly it is changed. Now we've gotten a lot better caring for these victims, and we know what to do, and we've learned a lot because with the conflict in Afghanistan and Iraq, and I know that you've heard about this, Congressman Thompson, from the testimony you've heard on Capitol Hill from the doctors and the specialists that have worked over there. We've learned a lot, and we've gotten much better in the way that we take care of these patients. But sometimes with the immense firepower that's out there in the street, that's hurting people. There are people that you're not going to be able to save, and that to me is some of the most frustrating things that I have to deal with. Is when I walk in a room, and I've been doing this a long time, that I know that I can't save the person because of the injury has been so catastrophic from an AR-15, AK-47, or a high-powered handgun that has caused devastating injury to the patient that's in front of me. So I can't save them, even though I have all the tools, all the expertise here at San Francisco General Hospital. But the incidence is certainly gone up from what it has gone within the last year or two. And it's more comparable to 5 or 10 years ago, where the numbers were much higher than it is now.
So thank you both for commenting on that. And there's no doubt that the numbers are rising. Just as an example, 22 million people purchased a gun during the pandemic year, which was a 64% increase from 2019. So this is a stunning new reality when you bring up, the example of the emergency room being full of violence issues and Thompson, when you talk about just the fear that kids have, even going to school today. So I'd like to ask you, Congressman Thompson, you are described as a common sense gun legislator. You've described some examples around background checks and, maybe defining the federal law beyond just if you go to a federal store to buy a gun, but you can go online and just purchase anything you want and put something together. So, how do we come up with gun legislation that can keep our communities and families safe, uphold the Second Amendment, and then find common ground for those additional 10 senators that you need? How are you going about that? So talk to us about that a bit.
All right. Well, you're right. Background checks, number one issue, and that's where we should start. We should start by passing that. Some of the other things that I talked about are certainly important. The ghost guns are a huge problem right now. And one town in my district up in the North Bay, they're bringing ghost guns in off the streets on just about a daily basis. Matter of fact, I'm meeting with the mayor and the police chief and the community activity person tomorrow on this issue. It's become a real problem, and there are folks out there that are marketing these ghost guns, and it just adds to the proliferation of firearms out on the street. And these are firearms that are purchased not only without serial numbers but without background checks, and people that are buying those aren't buying those for the right reasons, for reasons that the community would agree on. And Kim, I hate to be political on your Zoom call today, but a big part of the problem, it's a math problem. You need 60 votes in the Senate to bring a bill up for a vote. So most of us have grown up believing that if there's 100 people and they're going to take a vote, 51 votes wins. And that's usually how it is, unless you're in the Senate of the United States of America, where a majority of 100 people are 60 people there, and that's not working. It's not working well at all. Not only for gun violence prevention, but some other things that are really important to the American people. So we need to make sure that we elect people that understand that they have a duty to make our communities safer. And something, as you point out, is common sense, as expanding background checks, something that's bipartisan, something that has the support of 90% of the American people. There is no reason in the world that bill should not have been taken up in the Senate and passed the day after we sent it to them in the House. And we need to keep making sure that our voices are loud and heard, and that senators in all 50 states understand that this is this nonsense that the other side will give you about how we want to take your guns. Now, I don't want to take anybody's guns, but I don't want somebody who shouldn't have a gun to have a gun. And that's why background checks are important. We know they work. The data shows that, and we need to expand it to make sure people get a background check before they get a gun. And we need to do all the other things that we've talked about too, making sure these illegal guns get out of the queue, make sure that people who are buying firearms and reselling them to people who can't qualify to own a firearm, they need to be arrested. That needs to be stopped. The ghost guns, the easily concealable assault weapons, that's stuff that isn't compatible with a civilized community. This bump stock device where you can add an aftermarket device to a semi-automatic firearm and make it function as a fully automatic firearm. There is no reason in the world why that should be allowed. Now, to their credit, the last administration prohibited those bump stocks by administrative order. But it really needs to be a law to pass. So the next president or the president after that can't go through and reverse it. It's not right to be able to convert a legally purchased legal firearm into one that is not legally purchased. So there's a lot of work that we can do, and as I say, we're on the right track, but we still have that math problem to deal with.
Yep. Thank you. Really appreciate your leadership and your thoughtfulness around these issues. So I guess I really first want to thank you for your tenacity, perseverance, and optimism, both of you. And thank you, Congressman Thompson, for those very distinct ways for us to think about what can be done. We do have a new president. He comes with a new administration that seems aligned with your priorities. So that is at least something hopeful that you have been able to offer us. So I'm curious, Dr. Campbell, would you like to comment on what keeps you looking forward and gives you hope for the future from your perspective before we go into questions from the audience?
The first thing is that I agree with all the things that Congressman Thompson said about the background checks. We need to have safe storage. We need to make sure people who shouldn't have guns shouldn't have it. And the thing I just want to put on a pitch for is that we need to do more research to sort of to find out exactly, what are the reasons why all these things are happening, collect data, because for a long time we couldn't collect data on the federal government. There's actually a bill now that's in Congress that I wrote to Congress about looking at funding violence intervention programs in hospitals. It's a $5 billion program, a bill in Congress now. So those are things so the things that give me hope are the things that we've had a change in leadership in the government, and that people are talking about issues that are important to the American people. And I think that's really what we really want to hear about. Okay, well, these are things that really can concern us on a day-to-day basis. So, for me, it's like the change is something that's positive. The fact that, we have people doing great things, certainly in Washington. There's been maybe a standstill in Washington, but at the same time, there's been a lot of progress with the states, and many different states where they've done things like, restrict the age that guns can be sold to young people, and try to enhance background checks and then other things. So the states actually have been making a fair amount of progress, when the federal government has been having problems with the issues that were talked about with the Senate. So the things that give me hope is that people want to make things better. They are upset about what's going on, hearing about all these things that go on every day, and that in their city and their state, they're working towards doing things and still helping to coach the federal government representatives along as they do things, because those are the things that I think kind of give me hope that we have a chance to change. The president really is very empathetic and is pretty amazing in the way he deals with people, and there's terrible things that happen when he goes out and talks to them. He really is an amazing in that way, because he's had tremendous tragedy in his life. And I think those are things that kind of help encourage me as I go forward. But there's other stuff too, but I don't want to take up too much time talking about that. Thank you.
Thank you.
If I could just add, Dr. Campbell, the president has put forward a proposal to fund $5 billion for community violence programs. And those have been very successful. There's a number of them. I have one in my district that's done great. There are examples across the country. This president has nominated a director for the ATF, the government agency that oversees firearm stuff. We haven't had a full-time director in there for years, because during the Obama administration, they were prevented from voting to secure that position. And the last administration just didn't nominate anybody. So that's going to be a big help. And those research dollars that you're talking about, one thing that we, the Congress, did was to repeal what was known as the Dickey Amendment, which included federal funds from being used to study gun violence. And it was interesting because I'm the one that called Jay Dickey, the author of that amendment, in his retirement. And I said, Jay, this is really causing problems. And he said, no one's ever called me about it. I'm glad you did, because that's not what I wanted that amendment to do. He said, there was no way, shape, or form that I want to restrict that type of good research work. It's important. He sent a letter. We used that letter to repeal that amendment and allow federal dollars to be able to be used for research. So we have been able to do some things, but as I say, we've still got miles to go.
Thank you. That's really good to know about the $5 billion being allocated towards community violence prevention programs. Dr. Campbell, can you call out just maybe 1, 2, or 3 community violence intervention programs of that are associated with the work that you do at ZSFG?
So about 20 years ago, with the funding we got from the city and county of San Francisco, we started the wraparound program run by one of my partners. And that's really been a very successful program. It's reduced recidivism or readmissions to the hospital after you've been injured. Also helps people deal with the legal side of things, and also with vocation and many other things. So that's one program. There's a program in Philadelphia called Cradle to Grave, run by a good friend of mine, Dr. Goldberg at Temple, and I've forgotten Scott's last name, but he basically is a community organizer, and he's basically done a lot of intervention there. That's been successful. There's programs in Baltimore run by Cornell Cooper. There's things in Chicago run by Dr. Selwyn Rogers. So there are things that are going on in cities that have really made a difference, and it revolves around this concept of intervening, when they get to the hospital, but even doing outreach and doing things in an organized fashion over a long period of time, because it's proven that over a long period of time, interacting with the community, gaining trust really makes a big difference in terms of outcomes. But certainly, if they've published papers here that show that these programs are cost effective. They save money big time in the environments they're in. So saving lives, saving money, this is really, and making sure people don't get hurt again. That's really where things are at with respect to that. And there's $5 billion that we're talking about will help with all those things, and keeping people safe, which is what we want. Because I don't want to have to meet you in the trauma room after you've been shot. I'd rather meet you in a much more positive situation.
Great, thank you for that. Both of you have given some examples, both at the national, state, and local level. And so I'm aware of there's some local legislation that seems to be moving in a good direction in San Jose, not too far from San Francisco or your congressional district, Congressman Thompson. And it's about implementing a tax on gun owners to compensate for gun violence. Have you seen that anywhere else? Is this like a new policy that we should be thinking about? Would it help fund that $5 billion? I'm kind of curious what you would think, Congressman Thompson, and maybe Dr. Campbell, you'd want to add something there too.
Well, it's not a new concept. That idea has been floated in the past. I don't know that it speaks to the problem folks within the gun community. Most people, as we all have alluded to, aren't the problem. It's other folks. So, and I think it's important to note that gun owners and people who purchase ammunition, they already have assessed themselves a fee that they pay with every purchase, along with all other hunting related and even fishing related purchases that they make. And those monies are collected and spent as an investment in our habitats across the country. So I don't know that that is the best way to deal with it. But there's been some other ideas that have been floated at the local level. I think the same city is talking about requiring insurance for folks who have firearms, and that may be a way to deal with some of these issues. I know when I was in the state legislature, I had legislation that made liable the gun owner if they didn't safely store their weapon, and it was used to harm someone. Things like that are certainly a step in the right direction. But the local guys are going to do a lot in regard to leading in this space. And we've seen it with the red flag laws. We've seen it with some of the individual state requirements for background checks and other requirements for gun owners. And that's important. I just caution you, however, that we also have to worry about the challenge of those local efforts. And I think the doctor already commented on the attack on the California assault weapon ban that we just saw Virginia court overturn a long-standing federal requirement on age limits for the purchase of handguns. That's been on the books since 1968. And this three-judge panel in Virginia on a 2-to-1 vote overturned that. And it's going to be challenged. And I'm told by the people that follow these things that the likelihood of it staying on the books is pretty good. That the next challenge will probably overturn what the three-judge panel did. But then, we have the challenge of it being taken to the United States Supreme Court. And we know that with some new justices on that court that we really don't know where they are on gun issues. And the latest Supreme Court justice has a record that I would not call sterling in her past judicial life in regard to gun issues. So there's still big challenges out there, and that we're going to have to deal with.
Yep, there clearly are distinct challenges at work, both legislatively and in the court systems now. So another question that has surfaced is, how do we break the hold of the NRA's power and influence on so many congressional members? I'm sure that's something you think about regularly, Congressman Thompson.
Well, they've done a real good job of breaking their own hold. So they've got some internal problems. They've got a director, president, whatever he's called, who's spending thousands of dollars on tailor-made suits and private vacation travel for him and his family at the cost of millions of dollars that the NRA membership has contributed to pay for. And they've got some other issues in the state of New York. So they've done a real good job of self-inflicted problems. And the other issue is that the American people have come to the forefront on this. It's no longer the NRA dictating what's going to happen in the gun space. You've got all these fantastic groups, Gifford and Moms and Newtown, who are working tirelessly to advance gun violence prevention policy. And they're a very, very loud voice. And you saw that with the young people after the terrible shooting at the high school in Florida, where the young people rallied. And you had a Florida legislature that passed legislation that they never would have passed had it not been for the outcry from specifically the young people. And the governor at the time, now a U.S. senator, he signed that bill before the ink was on it. And he is no advocate for gun violence prevention. So this was pure politics. There were 300,000 17-year-olds who were going to be eligible to vote in that next election. And that sent a loud message to those electeds. So I think it shows that there's a lot of power. We need to know our power. We need to unite, and we need to move forward in regard to changing these laws. And I don't think the NRA is going to get, they're going to get in the way, but I don't think they're going to be able to hold back the power of the people.
So on that note, I'd like to come into a final question for you, Dr. Campbell, and then each of you can give your 1-minute manager final comment for the group. Bringing it full circle back, we've talked about a lot of issues today and how gun violence is a public health issue. So you just referenced young people, Congressman Thompson, and the hope they bring and the activism. So Dr. Campbell, how do we train the next generation of doctors to help us reduce gun violence?
I think the first thing you got to do is it has to be part of the curriculum that they're being taught, whether or not it's formal curriculum or when they're in the hospital here and they see everything. If you live in San Francisco, depending on where you live, you may not see any of the stuff that you see that comes into this hospital, and kind of seeing it, understanding it, seeing the impact that it has on people's lives, help them understand that this is something that we have to address. So I'd say, first of all, education, making sure they understand it. Also, get involved with things, participate, learn about things that they can do. And a lot of the young people in the School of Medicine actually been involved with some of the programs here at the hospital where they've been able to go out and just learn about things or write about it and publish papers on it and sort of expand the universe of knowledge that we have. So first thing is understanding that the problem exists, seeing it up close and personal, and sort of saying that, what can be done. So there was, I'll just give an example. One of my residents who was Asian saw some of the Asian Pacific Islander violence that has been going, Asian American and Pacific Island violence that has been going on, and he basically wrote a protocol where he wants to study kind of and learn about what's going on. So this is the enthusiasm that these young people have. They're like, okay, I see a problem and I want to approach it. And I think these are things that the stories repeat themselves, but that's what they do. They see the problem, identify it, they have youthful enthusiasm and boundless energy. And we just got to harness that, because that really is the hope for the future.
Thank you. Those are great final comment about the hope for the future. So we are so grateful for all you are doing, Dr. Campbell. Congressman Thompson, any final comment in the last minute, 30 seconds here?
Well, I'll just mention quickly a little story. A couple of years ago, I was invited to the most rural part of my district to speak to a high school class about gun violence prevention. And it was a trade-off. The kids were going to stage a walkout to protest gun violence, and that would have hurt the school financially. So the school cut a deal with them to have me come speak if they wouldn't walk out. And I was very impressed, because the student body president, in this, as I said, very rural part of California, he said, you can go to San Francisco and talk to school kids, and they can be against gun violence. He said, but it's much different when you come to Lake County and talk to school kids who are against gun violence, because everybody in this room has a gun or two at home. We're a rural area, and we hope that by us speaking out, that we'll send a message that it's not about taking your guns, it's about dealing with gun violence prevention. So I thought that was very, very powerful. And I think it was a call, if you'll excuse the pun, a call to arms, because there are a lot of responsible gun owners out there who should be speaking out. They should be saying, hey, what's happened is not acceptable. We need common sense laws on the books to prevent this stuff from happening. And I think that if we can get more folks like that on board, we're going to have more success. And we need more people on board. I had a longtime colleague and friend of mine who used to say, sometimes you have to create your own weather when you're trying to make change. And that's what we need to do. We need to create some weather. We need to get the winds blowing on our back. We need to speak out. and speak up. And we're on the right side of this issue. And we can't lose sight of that. And we just need to keep working on it. And I can't tell you how appreciative I am that Alex and the Hospital Foundation and Dr. Campbell and all of your colleagues are involved in this. Any way we can see an opening, we've got to go into that to spread the word. And if we do that, we'll be successful.
Thank you. Well, thank you for that call to action, Congressman Thompson, and for your call to action in terms of rising awareness on the gun violence issue, Dr. Campbell. And thank you all today for joining us, for your ongoing support that you give to the foundation so that we can support this extraordinary work at Zuckerberg San Francisco General Hospital. Thank you. Gratitude to all. Have a wonderful afternoon and evening.